Hello, everyone. Welcome back. I'm so happy to see you. It is great for you to be here. And I am super excited about today's guest podcast host. And you will learn to love everything about her. Her name is Katie O'Shea. She is a physical therapist and she is a Reiki master. In fact, not only is she a physical therapist, I just love the fact that she is a doctor of physical therapy. So I get to call her Dr. Katie for our podcast, and it's so exciting to have her. And I actually wanted so bad to have a podcast on this idea of Reiki as a way to heal our hearts from the great sadness. And you all know that we went through some really trying times, and we have to be open, right, to all different ways of healing. So again, my hope for this podcast is going to be that something might work for you. You might find that something is just magical for you and it clicks. And I love how the universe finds us, right? So Katie and I actually ran into each other after I actually did an education series, and we learned about each other's passion for healing. And I said to her, "You must be on my podcast." And so, Katie, I am so happy that you're here. So before we get started and we go into sort of what Reiki is and what are all the benefits, let's just start out by having you share with our audience a little bit about yourself and your background.
Well, hi, Arleen. Hi, everybody. Thanks so much for having me. I agree. It really is the universe brings together where you're supposed to be. And
Absolutely.
thanks for having me. I'm really excited.
Yeah.
My name's Katie. I'm an Aquarius, right?
Oh, I love it. I'm an Aries, so
I love that. I have been a physical therapist. It'll be 18 years in May. I have graduated, been practicing majority of that time in the healthcare space, the traditional Western healthcare space, both on the management and operation end, as well as the clinical end. Really, my love for clinical care is acute care. The sicker you are,
yeah.
the happier I am. Um, and the operations side, I really got into operations because I wanted to make a difference. I wanted to help foster growth and relationship for therapists and where our place was in the healthcare model. And traditional healthcare is hard right now.
Yeah.
Insurance is hard, regulations make it hard. And that always led me to ask, how do we do it differently? Why is it so hard? Right? When we keep running into resistance, why? And that's my curiosity that gets the better or worst of me, whichever way you choose to look at it.
I love it.
And that's how I sort of stumbled into Reiki. Reiki's been trying to find me since I was a teenager, and
Wow.
I kept ignoring it. I like to share the story. My very first massage, I'm a very wise 16-year-old going to get my first. And this wonderful masseuse, I don't remember her name, is like, "You really need some Reiki." And I was like, "What's that?" And she said, "Oh, well, it's energy healing. And we just touch." And in my infinite wisdom as a teenager, I was like, "No, no, honey, rub my muscles."
Right, right. Please don't touch me, right? Just to
Okay.
heal my body, right? Absolutely.
Do the rubbing. But anyway, so Reiki had been finding me for a long time, and I just kept ignoring the call. I ignored the whisper. And as I got into my career and the healthcare piece I was mentioning, it just became more apparent that there was so much more to it. So that's how the Reiki training fell into my lap. I didn't go looking for it. It came and found me right when I was ready. And I did my first degree in October of 21, my second degree in October 22, my second degree of January of 23, and my Reiki master in the October, November of 23. And
Wow.
it's just one of those things that's found me, and I think it's part of our journey, right? It's
Absolutely. I'm like a big believer in that. And all throughout this podcast, one of the things that I really love about healthcare workers and just, the span of what we do is so profound, right? I mean, it's so many different disciplines, right? Here you are as a physical therapist, right? Going about your way, thinking like, I'm going to do this, right? This is what I'm going to do. And then, life takes sort of a turn and it really puts you in this natural path. And again, this demonstration that you are here in life school, right? And your journey is to be a healer, right? And that is really manifesting in sort of this idea of Reiki and energy healing. And I actually had Reiki done one time, and I honestly don't even have a good explanation as to why I don't do it more frequently. I'm really quite embarrassed to say that I don't do it as frequently, right? Because it is so eye-opening, and it's really, it just changes sort of, I think, everything that we think. So let's just talk a little bit about the practice of Reiki. Like, how do you actually prepare somebody to actually do that work? Like, what are the steps and the things that you're thinking of as you're kind of getting somebody ready? Somebody maybe that has never even, they don't know Reiki, and they don't even know, and they're thinking themselves in their head, like, what is this energy healing and how is it done? So like, explain it like we're five, right? Like, how would you go about doing this, right? To somebody that really would be curious like you were and interested and wants to try it out.
Right. So I always start with, have you had Reiki done before? What do you know about it? And
Right.
usually it's the blank stare. And I don't know, but I just came here. And so I just, I start with, well, let's talk about what Reiki is. You already said it, Arlene, it's energy healing, right?
Right.
We heal our body in the Western medicine world. In our Eastern holistic practices, we acknowledge that there's an energetic presence about us. It's not a religion, it's not a doctrine, it's energy. And so we kind of put that out there. And I say, do you have any questions? Are there any myths we need to talk about so you can be comfortable?
Oh, I love that.
Right? Because a lot of it's myself included. In the beginning, I was like, "What is this? This is freaky." And sorry, Reiki schools, right? It's because
Right.
there is a, I don't know what's the right word. There's an
Maybe
unknown.
it's just a maybe it's just like a I think sometimes people, we have a tendency as human beings, this, right? We have a tendency to sort of label things, right, as not normal, maybe in a practice that we think, right? Very quickly, the brain just sort of is like, I don't know about that, right? And so it's very easy for people to dismiss things and discount things. And if you look in our world, right, we see this all the time in pretty much everything. So that's why I said, part of this journey for healing the hearts is really, as healthcare workers, why wouldn't we want to be open to a different way of healing? And that would be the challenge that I would say to most people. Like, tell me why you wouldn't want to be open to something. Like, if it would work and it could possibly work, why wouldn't you want to know about it? So,
And that's such a beautiful thing because to my healthcare workers that I do see in my office, I will say, if this were an investigational drug,
yeah,
or you were in a study, would you try it?
right.
Right? You would put your faith in medicine, in our traditional medicine system, and you would try it. Right. And so that's something I talk about with clients. Sometimes we get to a place where we've tried all the alternatives. We've tried the medication, we've tried the counseling, we've tried, sticking our feet in the grass. We've tried all the things, right?
Right.
Maybe hung upside down and swung on a string, whatever it might be. And so I say, if your doctor said to you, hey, this pill will actually help you feel better, would you do it? And people
Yeah.
are, for the most part, say, yeah, because that's
So,
what we
sign me up, right?
right?
Yeah.
And I get 90-day meal supply at a cheaper copay, right?
Right.
And people look. So that's one of the biggest conversations we have when we're talking about some of the myths of Reiki, right? And that it is a very widely accepted holistic medicine practice. The healthcare nerd of me, this is where my DPT comes out. And Dr. Besser, if you ever hear this, she'll be so proud that I read the research. I actually read research. And heard, right? But there are tremendous research studies coming out on the benefits of Reiki.
Yeah.
And for us Western brained healthcare providers, we like facts,
Right.
right? So that is something I will bring up in those conversations when people ask me, what is this? What does this do? How is this beneficial? Right? We know Reiki is hugely helpful for managing anxiety, emotions, sleep, non-pharmacological pain interventions, right? So we talk about that in that office setting. And then when you ask about, what do people expect? So I bring them in, I sit them down, I say, here's what we're going to do. You're going to lay on the table. You can have a blanket over you, no blanket over you. We're going to get you comfortable. And then it's light touch. And I say, is it okay if I touch you? Consent is hugely important, right? And I show them what that touch is going to look like on their arms. I go over the 7 chakras that we cover in a Reiki session and ask if they're okay with touch in each of those areas, right? Because we don't know what people are holding. And we're asking people to relax, close your eyes, get into a Zen meditation kind of state. That can be very jarring for someone then to feel touch or pressure, even though it's very light. So we talk about it, right? We put
Yeah.
everything on the table. What does it look like? You know, and most people are fine with that. We don't touch the heart chakra and the root chakra, by our genitals for very
Right.
obvious reasons, right? Like not
Absolutely.
that kind of
Right.
not that
It's
kind of
not
all over
that kind of
the place.
practice,
Yeah.
right? So let's just be clear.
Okay. Not that
Just if
kind of practice.
anybody's wondering out there and they're saying like, wait, what happens with this? Yeah,
Right.
100%.
There's a place for you. It's not with me. But so, we talk about that and then we get them on the table. There's some, some candles. It smells good. Some nice, sage cleans everything. Um, and then we do a little meditation, let out the old, bring in the new. We ask for healing and intention. The beautiful thing about Reiki is it can do no harm. And the other beautiful thing is Reiki is smarter than all of us. It is energy and it's going to heal you where you need to be healed. Right. So, people will say, oh yeah, I want to be healed and I want to attract so and so into my life. We can ask for that intention, but Reiki is going to give us what we need,
What you need.
what you need. And we talk about what people might experience during a Reiki session because that's really important. My first Reiki session, I was in tears and
Yeah.
I went in such a skeptic, which is such a huge thing that I tell people. I didn't think it was going to do anything for me. One of my girlfriends got trained during COVID. She was like, let me do this for you. Okay, sure, Mayor, anything you want. And I laid down. Okay, go ahead,
Yeah.
And next thing you know, just this
The
release
release. Yeah.
up, and it was beautiful. So we talk about that. Hey, this might happen. You might feel warmth. You might feel tingling. You might see colors. You might fall asleep. You might feel nothing, and all are okay.
Yeah.
And that's something we talk about. And for our folks who have had Reiki sessions, every session looks different, and we talk about that too, because people.
I love that. And I will tell you, like when I've had it done, that's what I remember really is that warmth, right? It's just it's indescribable. And I think as human beings, I mean, when you just think about healthcare, right? And you think about how healing occurs, right? Um, there's things that immediately come to my mind, right? Our environment. That's key, right? And an environment where it's really intentional, right? And it's really meant to have somebody get into a deep relaxing state is so key. Even as a nurse, like there was a journal entry that I had during COVID where we had several call outs of CNAs. It was really a busy time. And I was working 7 to 3. And, I was trying to help deliver food trays to residents in their rooms. And I was rushing. And one of our residents, like literally when I came into the room, she put her hand on mine and she was like, honey, why are you rushing? And it was like, bang, like right in the eyes, right? I was like, wow, you don't realize it, right? Because from our perspective as like a healthcare worker, right? We're rushing, we're trying to get to that next thing, right? Because we think that everything has to be like every single time has to be filled, like every single gap in that time has to be filled. And I think part of that is due to our world, right? I mean, you see that,
You see it all the time, right? The instantaneous culture. There's a notification on our phone. It's almost a competition who can answer the email fastest,
right?
right? And for frontline clinicians, a lot of us have productivity standards
Yeah.
that are a little unrealistic, but based off of insurance reimbursement and
It is
healthcare,
what it is, right? Yeah.
right? But it's hard when you only have 30 minutes of downtime in your day that's not scheduled. You don't have time to be a human. You have time, but you miss the moments that are presented
Miss
to
the
you.
moments in between. Yeah, so, when you think about Reiki and you think about this from a perspective of healing, let's like sort of compartmentalize this a bit. Like, let's say, I know for me personally, when I look at like all the pain and suffering that, that I experienced during COVID, right? One of the things that I struggle with was those repetitive, recurring sort of scenarios that would just replay over and over in my head. And I know many people who have gone through COVID have struggled with those same things, right? So it's that repetition, right? For other people, it's right this tremendous sense of guilt, right? You just feel like you're carrying this weight of the world around with you. For other people, like you said, it's a manifestation of anxiety, right? All of a sudden, out of nowhere, it's like bang, you feel something welling up and you're thinking, I don't know if I can manage this or handle. And if any of this sounds familiar and you're like, well, wait a minute, I'm not even in healthcare and I have this, that's true too, right? Because
Yeah.
we're human beings, right? And we're all navigating this crazy earth, and we're having these experiences. And again, that's that representation that energy travels, right, between us. So I'm really curious, when you think about like the people that you provide care to as a Reiki master, what are some of the things that people are coming to you with, for in particular, where like they're really searching and they're saying, I could really use help with this. Like, give me a few examples that works for people.
There's definitely some recurring themes. Relaxation seems to be one.
Yeah.
Sleep seems to be one, better sleep. And that getting rid of those intrusive thoughts in the middle of the night, the hamster wheel.
Yeah.
Um, and then I see a lot of folks in that sandwich generation who are saying, I need to take time for me because I am burning at both ends and I am not doing well.
Yeah.
Those seem to be if I had to pick top three, those would be the top three that the folks come in with, looking for help with,
Yeah.
and what I find interesting about Reiki and the practice of when people are calling for sessions, they want to come that day
Oh, wow.
because and think of our society, we are reactive versus proactive,
Yeah.
not conditioned to make ourselves priorities, right? And at that, I see that a pretty high amount actually, which was interesting to me because I think about, oh, if I want a massage, I'm going to look at the schedule and call ahead and da da da, right? But that's not how the work works.
Like, I want to press a button and be like, bink, right? Like the Jetsons, right? And everything just like happens, right?
Yeah, right, correct, absolutely. But those are definitely, I would say, the top three things. And it's wild to watch when a client is on the table and you actually see the moment where they let go and
Yeah.
where they just relax and be. One of my favorite clients I met at a community fair, and it's always harder when you don't know someone. I shouldn't say that. I thought it was harder when you didn't know somebody because you don't know the person, right?
Yeah.
You don't know. It's nice when you have a little cheat code of some triggers and some background.
Absolutely. I know this person, right? I know they get a little worked up, right? Yeah.
Right.
You know nothing, right?
Nothing. So nothing. They're cold. They're off the street. You are trying
Right.
to remember their name because they said it 5 minutes ago, and you've already thought about what you're having for dinner. Right? You don't even remember their name. And this woman, very nice woman, she said to me, we were talking about what to expect, and is it okay to touch? And she said to me, "It's fine if you touch me, but I'm sorry if I punch you."
I'd be like, okay, all right, ding, ding, ding. I'd be like, I'm getting a little nervous,
Yeah,
right?
like starting to knit my red flag scarf here, right? Like putting on my red flag mittens so I don't get hurt.
Yeah.
And I was like, well, we can do hovering. We don't have to do, it's still in your energy field. We don't have to touch. She's like, no, no, you can touch me. And I was like, oh,
Yeah. I just don't want to
okay.
walk out with a black eye, right?
Yeah.
Yeah.
Got a pretty good track record for not getting hit by patients in the hospital. Which
Right.
I like to keep that up, but that's fine. And we finished. She did not hit me. She actually
Right.
fell asleep on the table. It was
Wow.
actually hard to wake her up. And then I'm like, oh, how do I wake up this beautiful soul?
Right.
And she said to me, she's like, I cannot believe I didn't jump. She's like, her family, they hug her. She jumps to the ceiling. She's like, I cannot handle touch. And
Wow.
for someone to be able to receive that gift, right? And just to find a place that is total stranger that they also don't know, right? Just to lay on that table and be so vulnerable and so open and let that energy work do what needs to be done, I think is just one of the most beautiful gifts.
Yeah, I think, when I was doing my research for this podcast, one of the things that I really like, some of the words that just kind of popped out were like, balance and harmony and really like finding that like deep, deep, deep relaxation, right? That peacefulness. And I think as healthcare workers, we tend to run ourselves very, very thin on both of those edges. And I think that's just normalized and it's a practice that we all do. It's very difficult to not work in that space because that's just the way we are. It's kind of conditioned. And I think it has to do with why it makes us so resilient when it comes to just like we're going to keep coming back because like we have that internal feeling like we've got to help this person, right? It doesn't matter. Like as long as we're helping somebody, we're doing great work and we're doing our life's purpose. So I do think that's a big piece, but I also think, we have to look at those opportunities to just really look at this alternative way of healing to say, how might this really benefit me and supplement me to really help me still continue healing, right? And so I can still do the great work that I'm doing, but I can find those, like you said, those moments, right, where you can get into that deeper relaxation, or you can get to that place where there's more balance and harmony. And even if it's for a window of time, like a few hours or a day or two, why wouldn't we do that, right?
Absolutely, right? Like we deserve that opportunity to heal ourselves. Folks that, you know, make going to the gym a priority in their lives, right? It's the same idea, the same concept. You know, you wouldn't go 30 days without drinking water. You would never survive.
Right.
And it's the same concept. Why it's the same concept of being on an airplane. You got to put your own mask on before you can put somebody else's on.
Yeah.
And I think as healthcare workers, we're just not trained to do that, right?
Yeah.
We are conditioned and almost rewarded for putting ourselves last.
I think we do it to ourselves. I really
You
do.
know?
I mean, I want to believe that. I think that, I think part of this journey for me, when I look back at my journal entries, and at some point I really do want to write a book and I really want to journal sort of those feelings. But when I look back, I can see that a lot of that pressure, a lot of that sort of, push to just get things done comes from a place, I want to believe, like, we work optimally when we feel like we can do things really well, right? That we're super proficient and we're really good at what we do and we can do it as quick as possible. Like, that's when we're like in this sort of natural flow state where we just like we feel amazing as a healer, right? And what I saw with COVID was it was everything was fragmented. There was no patterns. Everybody was junior, everybody was working at this very low level of nobody knew what they were doing, how they were doing. People were learning from each other on the internet. I was in Facebook groups, we were all like, oh my goodness, how do you, I remember, and I really talk about this in my journal entry. There was a newer nurse that I was working with. I came in, we found out we had all these patients that had COVID. And I was like, all right, like, so, what did you do? Like, literally tell me step by step what you did, because I want to do something similar, or like, you don't have a frame of reference. And I think as healthcare workers, one of the things that I'm hoping in this journey is we get more comfortable not being in that frame of reference where everything has to be easy, squeezy, perfect. And like, we're all doing it. Right. And we all know exactly what we're doing because it's human beings. Right.
And I think that actually, when we talk about that traditional healthcare space, what we're doing probably isn't sustainable for decades to come.
Right.
So we have to kind of think differently, right? Of what has worked, what hasn't worked.
Yeah.
How can I learn from you versus looking at you as competition,
Yeah.
right? Or and to enhance healthcare for the patient, but
Right.
satisfaction and work-life balance for the employees,
Yeah.
right? Because if we're not good for ourselves and we're not good for our families when we go home, and we're not sleeping well and we're not eating right and we're cranky and stressed and we're snapping at people, and then we come back to work the next day to just get more stress piled on us.
Yeah.
It's there's a breaking point. I think there's a tipping point. And I think it's, to your point, how are you doing it? I want to do something similar that's working, and give it my own flair.
Right.
That's
Yeah, 100%.
great.
So one of the things that I'm really curious about is, um, uh, one thing I recognize in healthcare, and you probably are like, yes, 100%, right? I think that, the truth is that people come into healthcare because I want to believe that we're the people that are wired to care, right? So, like, in that exchange of energy, right? And me healing somebody else, I'm getting something, I'm filling up as well, right? So, I'm filling you up and you're filling me up because there's something that I need from that exchange, right? But what I recognize is in the crazy world that we live in, um, you know, there's a lot of negativity, right? And in previous podcasts, I talk a lot about, our brains and how they're wired, and they're sort of wired to that negativity bias, right? So we tend to lean to negativity, and we see a lot of that negative energy. And I'm curious, as just like being a Reiki master, how do you help people to block some of that energy. Because I am a person that I feel like I've been put on this earth to, bring joy and happiness. And I always am that sort of, the cup is half full person, right? And so even in difficult times, really, really, really hard situations, I'm always like, well, let's look at the silver lining in this, everybody, because, we have to, right? That's just who we are. But there's a whole lot of people in healthcare that cannot do that. And if you're a person like me and you're around somebody and you're working alongside them day in and day out, right? That energy travels. And so how do you prepare people to help them see, like, you can block this? Because I really want to know how to do the blocking, right?
It's I have to give my Reiki master Susan Drummond credit for this one.
Mm.
Because this is her little idea that honestly I stole, and it works really well. So every day when you brush your teeth, you almost pull up an invisible, I think, plexiglass shield. I do a cylinder around my whole body because I don't want to go into through the back or the front, right? And then I just, my protection's up. I'm set. As a Reiki practitioner, we ground ourselves before and after every session, and then we
You
disconnect,
have to,
right? Because I want to help you. I don't want to take your energy on, baby.
right?
And so that's one part that we do as Reiki masters to protect ourselves. But
So
for
it's a visualization.
visualization, and it can be anything, right? So she says do it when you brush your teeth, because what is something we do every single morning?
Right.
We
Yep.
brush our teeth, right? For me, getting used to that was very hard. So I set a timer in my phone every morning for 5 minutes after my 15th alarm clock when I'd
Right.
be brushing my teeth.
Yeah.
And that was my opportunity to get into that practice, and now it's second nature. And one thing to think about when we're setting our protection for the day, whatever that looks like, right? I like the visual of a clear, because I want that exchange. I don't want a brick wall in front of me, right? Because
Right.
that, to me, that's a block. But that might work for somebody else. So you have to find what works for you. Um, but throughout the day, especially when I'm in the clinical, a hospital side, every time I'm entering and exiting a room and that hand sanitizer, for
Yeah.
me, that's an opportunity to disconnect what I'm bringing in, and then disconnect when I'm leaving again, and leave any energy I picked up, right? Because I'm not doing any good to my next patient if I am leaving a patient's room who is negative energy, 100 out of 100, right?
Right.
And now I'm going into another patient's room whose energy's good, right? And if I'm coming in angry and frazzled and what does that do for that next patient? So I disconnect after every session. For me, it is the act of, wiping it off my hands.
I love that idea, the hand sanitizer, because we all have to do that. It's like infection control.
Right?
That's the nurse educator in me. It's like it's so incredibly important, right? That we do infection control practices. Like, we have to rethink how we do things. And I know I absolutely have tricks for that, for infection control when I teach, because I recognize not everybody learns it the way they should be doing it, right? So I love that idea of, it's just like you get into that sort of visual reminder of, like, in between, right, your patient care, when use that, either you wash your hands or you use that antibacterial gel. It's like, that's it, right?
Yeah. And something that I didn't think I personally realized for a long time is that in the beginning I thought, okay, I set my protection in the morning when I brush my teeth, and now I'm good. Well, guess what? The day happens, and sometimes I'm human, right? And sometimes other people are human.
Yes.
So there's nothing wrong with resetting that and that protection throughout the day, right? So when you find yourself in a challenging scenario, which, let's face it, they happen whether you're in the healthcare spec industry or you're at Target,
Or
right?
exactly.
Those situations happen. So even when they're mid situation, and I can feel, those emotions heightening, you get the flush, you get the the redness. I reset that protection. I reset that boundary in
So
that
it's
moment.
just through repetition. You're getting into this regular practice. So, that's what our audience will have to learn how to do, right? Is it's, again, it has to become like the nose on your face. Like, you don't not see that you have a nose. You, like, I know I have a nose. I look at it all the time, right? You see it all the time, right? So that's how that habit has to be reformed. I love that.
And not for those perfectionists of us out there, not being upset with ourselves if we miss a day, if
I
we don't
know.
handle the situation right, right? Because I don't know about you, but sometimes when I'm learning, I expect to be an expert right away, and I
Oh,
wanna
please.
skip the
Yeah.
novice and intermediate stages, right?
Yeah.
And, you mess up, and that's okay. That is beautiful. Just reconnect and reset, and what I found personally, as I was setting that protection and giving myself that barrier, I was feeling better. And when we find things that start to make us feel better and more in control,
Yeah.
what happens? We wanna keep doing it. We buy into it.
Yeah, 100%. And I think, it's like anything in this world, if we're going to get better at things, some of it is learning the art of letting go of the control, right? We want everything to be a certain way, and we have to just recognize that's really not living, right?
Yep.
I mean, we're not experiencing moments of joy and happiness when we're in that state.
We are certainly not.
So I want to believe, like in life school, this is what we have to be like appreciating is the moments, right? That you have. And I'm sure you see that a lot even in your physical therapy sort of world, right? Where you're healing somebody and they get that confidence, or they're so proud of themselves, right? And it probably takes your breath away a little bit
It
as a
does.
practitioner.
Almost 18 years, I still cry when the
Yeah.
I think of a patient I had recently who had been laying in bed for almost 10 months,
Yeah.
kind of rotting away, quite frankly, had had her leg amputated and, just didn't there was a couple hiccups in the system, right? It happens, unfortunately, and took 3 of us to stand her,
Yeah.
and within a month, we had her prosthetic, and she was walking, and she is not laying in a bed. She has a future of going home that she's excited about, and there's no way I can't cry when I think about that.
Of
What a
course.
blessing to be part of that. What a blessing to be paired with that OT and that other PTs and other codas that helped her get there, and that's beautiful. 18 years, it's a time where you can start to get jaded, and to be able to have those emotions and those connections, I think you know, keeps you coming back for a little bit more.
I think it's fantastic. So tell me something that, like as you do your Reiki practices, what has like been a big surprise to you in this journey, like that you did not anticipate when you went into it?
I did not anticipate the reception and warmth that I got from people.
Yeah.
I expected a lot more criticism, and what are you doing? Right? Here you are, MBA, DPT, you're
Right.
going holistic? What are you doing, Katie? I expected a lot more of that. And that has not even happened once yet.
Yeah.
And that I think is one of the most beautiful things. And I think even my connection to Reiki, to the energy, I didn't expect it to embrace it in this way. I didn't expect this to become my career pivot. I didn't expect this to be the message that I thought I was getting out to the world. Right? If you asked me that 5 years ago, I would have told you I'm an operator and I'm going to put a system and a binder in place and I'm going to make a difference that way. Right?
Right.
And that shift for myself and to be able to step into that power and that purpose has for me been a very personal thing that surprised me as well, but also the reception from others.
I love it. I mean, I think like even for myself, I think that while we're here in life school, such an important lesson is our ability to be open. And when you look at our world, I think we see many, many examples of people that cannot do this.
Mhm.
It's not innate to them and it's very foreign to them, and they tend to be very close minded, right? And whether it's they judge or they put a label on something, or they have an implicit or a bias, it's there. And I don't think that the person can really see it in themselves. But I want to believe that, the more we can get people to just be open to something that's different and to not get ourselves in an emotional state where we start to let that take over, and we just instead learn to sort of shift and say, instead of me responding this way, right? I'm going, reacting, I'm going to respond, right? In a different way, and respond with openness. And I do think there's so many examples even in nature of like when we're just open, whether you're walking in the woods or you're, walking along the beach or whatever it is, if you're just allowing yourself to just be in that natural state of flow, right?
Mhm.
How it sort of really alters sort of the way energy works for you and what you see and how you see things. And so as healthcare workers, we're around a lot of people who are not well.
It's the majority, right?
Right?
It's the kind of
Nobody's coming in and like, woo, I feel great. Can I stay extra time? Right? It's not
model actually, right?
it's not like that. It's not like a spa where people are coming in and lining up, right? So, but we do have to think about that, right? How it affects us and the way we practice.
Mhm.
So, how do you feel about that when you think about that just from that perspective of like just really thinking about the way that we practice and how, just being open to just letting the energy flow and experiencing someone else's energy in a really positive, healing way, how that could change maybe the way a person sees the world.
Yeah, I mean, I think it's beautiful, honestly. One of the Reiki principles, so to speak, when I'm practicing Reiki, I am also healing myself at the same time, right? As I'm giving energy, my cup is also filling up. That is one of the beautiful things about Reiki. It is abundant and does not end. And I think as healthcare workers, that applies to us. And you mentioned this earlier, right? We're giving, but we're also getting back in return.
Yeah.
And that's huge. My Instagram notification that wants to show me a cute dog, whatever
Right.
it might be, right? Just being present in that moment, because that moment is quick, it does not last forever. And that's our whole life, right? And so when you're sitting in gratitude of that moment and what am I supposed to get out of this? I find the clinical work much more rewarding than when it's just checking the checklist and trying to feverishly and productively be the top of the day, right? Get my work
Yeah,
done.
I agree. I mean, it's not that it isn't important. It's so important to how we do things, right? We all want to be effective and we all want to be proficient and achieve mastery in our work as healers, right? So I'm not saying that that's not important. It's incredibly important, but I do think we can go about our day a little bit differently by thinking about things and just allowing us to experience those moments, those very special, tender, soft moments when healing is occurring, and that's an energy exchange that's happening. And maybe it's our kind words that we say to somebody, or maybe it's a touch, right? Or it's just, I always say, as a nurse educator, we just don't know. You could be the one person that this person interacted with that has said the kindest words that that person has experienced in a very long time. I mean,
Mhm.
it's sad, but it is true.
How often
Right.
does that happen?
Right.
That is a very stark reality.
Yeah.
And sometimes you don't even recognize that it's happening in the moment.
Yeah.
I mean, I recently had a patient in the hospital setting who the hardest person to communicate with, you
Right.
know, very dry, very cut off.
Yeah.
So you're like, this is gonna be a long hour.
Long session. Right.
Why am I in the hour setting of rehab right now? I like my, 30-minute acute care sessions. Anywho, and I'm sitting there and my critique of my head is, oh man, this person must can't wait for me to get out of the room. They must be so done with me. They're shut off. They're not talking to me. And then the next day, that person who hasn't smiled has the biggest smile. Do I have you today? I was like, you like me? Really? I annoyed you. And
Right.
but it's those moments where you think you're not making a difference, where you think your kind word or your smile isn't impactful, but it really is. And you're creating rapport, you're creating a bond, and you don't even realize it when it's happening sometimes.
I love that. So, for the person that might be sitting on the fence and they're sitting there thinking, I don't know if it's something I'm ready to try, what advice would you give them?
I would say, do you want to feel better? How
Mm,
do you feel now? And are you willing to take a chance on yourself to feel better? Would you watch a TikTok video and buy whatever they're telling you because an influencer told you to do it, right? And if you would, then take the chance on yourself and try a Reiki session.
yeah,
If you're looking for a way to find that deeper inner healing and work, I think you are worth that shot and worth that opportunity to see if it works for you. If it doesn't work for you, that's okay. right?
What have
It's
you got to lose, right?
Yep. I'm pretty sure for at least you'll enjoy 45 minutes of relaxation and some enjoyable music, right? At the worst case
Yeah,
scenario.
I love that.
And
So I feel like we could talk about this topic all day long, right? But boy, all things in life must end, right? And come to a conclusion. But before we do that, I do want people to be able to get, I always say, when people come on our podcast and they're a guest podcast, I want people to know they can always reach out right to our guests. You're available to answer questions or even just be a source of support. But tell people where they can find you, Dr. Katie, and get themselves on a track to heal or at least try this therapy to see is this something that might work for them. Where can they connect with you? What's the best way?
yeah, so the best way is through my website, drkatieoshea.com, or through my email, drkatieoshea@gmail.com. But I would say the website is probably the best landing page. It has a lot of information about Reiki as well as, the yeah, traditional healthcare model that I am so tied to, scheduling options, and Reiki is both in person and virtual. In person, my office is in Medford, New Jersey, but virtual Reiki is also an option, and a lot of folks I was also surprised to find really enjoy virtual Reiki because they're in their own home environment and they don't have to drive home after they're nice and relaxed.
Oh, that's amazing. I love that. I love that.
drkatieoshea.com. Yep.
Well, I love it. And I want to just thank you for coming on the podcast and sharing something that you're so passionate about. It really comes through. And the thing that surprised me the most is, I think when people are really passionate about something, when it connects to their purpose in this world, it just emits through their body, right? And you can see it. And just, connecting with you, I can just see just the joy and the happiness and like the professional satisfaction that kind of oozes out of you. So you should be proud that that energy is giving you something back in return.
Thanks, Arlene. I really appreciate those kind words and that recognition that means a lot. It makes my heart smile. If you're
Yeah.
not watching, you can't see I am smiling. It makes that feel good heart moment too. So
Absolutely. And it means it's just a validation, right? That you're doing what you should be doing here in life school. And like everything, we're learning and we're growing. And that's probably the most important thing that as we're on this path, we really are manifesting this ability to just be open to all the opportunities. I mean, why wouldn't we? Because what do you have to lose? You have nothing to lose except your ability to control everything, which is incredibly impossible, right, for everybody. So I
correct.
would definitely say that.
Thank
Well,
you. It was great. I love being here.
yeah. So listen, if you don't hear it enough as healthcare workers, you know how I feel. I'm so passionate about this, right? Thank you for everything you do. I recognize that you make a conscious choice every single day in and day out, to come back and do it again over and over again. So on this journey, as you're healing your heart, take care of yourself and know that you are doing soul filling, purposeful work that has meaning and that it is appreciated and validated by so many of the people that you're providing care and services to. So thank you, everyone. I hope to see you on a future podcast. And thank you, Dr. Katie. I am so thankful to have you, and I feel relaxed. So goodbye, everyone.
Okay, thanks again.